Hi, my name is Dr. Irma Juarez-Drew, and I am a certified chiropractic sports physician. Today I'm going to demonstrate how I do a Graston session with a little tiny bit more of patient interaction. Jessica here is going to demonstrate a typical swing of either a racquetball or a tennis racket, and I'm going to be doing a Graston session on her to improve the mobility of her swing. A lot of times athletes will come in and they will complain of pain or limitation in movement during their sport-specific athletic movements. So I'm going to show you how I can loosen up the patient a little bit to improve their ability to move during their athletic movement patterns. So go ahead, Jessica, go ahead and just go through a typical swing of the tennis racket and take it all the way over. Now, sometimes when patients come in, they'll tell me that they'll get to a certain spot that hurts or feels like it's pulling. So I will utilize my Graston instruments to actually loosen up those areas and break up adhesions or scar tissue formation that could be limiting that movement. So go ahead and go through your movement pattern. And typically what I'll do is I'll start off by scanning the area to feel where she's actually getting that pulling or that limitation. And I'll ask the patient, where do you feel that it's restricting you? Where do you feel that you're not able to move? And wherever the patient tells me, that is the area that I'll typically focus on. So go ahead and go just a little tiny bit slower, bring the racket back, and then go all the way across. So I'll also come across here, across the shoulder, across the back of the scapula. Okay, just hold it right there. Okay, and what I'll do is I'll work the area, and I'll get those areas that she tells me feels restricted. Once I loosen those up, then I'll have her go ahead and go through her movement pattern, and typically she'll be able to go further into the swing and she won't feel that pulling sensation any longer. I'll also take it in different ranges of motion. So now what I want you to do is I want you to take the arm and I want you to reach across this way and then bring it down really slowly as I attempt to treat different areas of the body. So I can come across here and hit part of the abdominal musculature. I can get into the serratus, into this area. I can get into the lower abdominal musculature here. I can work the latissimus dorsi and really improve the mobility that the athlete has during their range of motion. So that was just a really quick demonstration of how we can do the Graston technique with the patient actually assisting and going through their athletic movement patterns, so thereby we can improve their athletic ability and their movement and hopefully improve their sport. Thank you very much for listening.